Welcome back to Living 808. It's one thing to have the right car seat. It's another thing to have it safely installed in your car.
Yes, in today's In Sickness and in Health segment, we visit Adventist Health Council to get some tips on doing it right. We are here at Adventist Health Castle. We're talking about car seat safety today. I'm here with Stephanie, who is a child passenger safety technician and instructor. Also joining us, Lori, who is the director at the Birth Center. Hello, ladies.
Hi, welcome.
Thank you very much. I'm very excited about today's topic because I remember very clearly when my daughter was born, my firstborn, my husband and I had no idea how to install the car seat correctly, and I'm sure we're not alone, right?
Not at all. 80% of car seats are installed incorrectly, so you're not alone at all.
80%? That's
Yes.
a lot.
Yes.
Wow. Okay. Well, Stephanie, let's back up a little bit. How do you choose a car seat?
Great question we get all the time. You want to choose and look at the instructions of the car seat and get one that's at the highest weight limit. You can keep your baby in as long as possible, and also one that can fit in your car correctly. Sometimes you can even take it out when you're buying it and see if it does install correctly.
Okay, great. Now, I did hear that there are expiration dates on car seats, which I bet a lot of people may not be aware of. Why is that, Lori?
So all car seats have an expiration, and there's several reasons why, but most importantly, car seats are primarily made out of plastic, and some heat, some sun, and that plastic's going to degrade and get brittle and can crack. And so it's a great idea to check your car seat, even if it's not expired, to make sure that it's not cracked. Metal parts, too, can get rusted. They can stop working.
Okay, great. So there's typically a label behind the car seat, or maybe they can even check the manufacturer's warranty. Is that right?
That's right. In their manual that they give with their car seat, there's also a registration card, several places to look. But there should be a sticker and imprint with the manufacturer date on the car seat.
Okay, Stephanie, what car seat options are there?
There's several. One would be an infant carrier that you can take out of your car so the base stays in. Another one would be a convertible car seat, which we have here, and baby stays in rear facing. Your goal is to keep your child rear facing as long as possible. So the convertibles can go up to 40 or even 50 pounds rear facing. Then you can turn the baby around to forward facing. It's not a happy day when you can do that because babies are 500 times less safe forward facing. So then that car seat can possibly break down to a booster as well. And your third option would be just the booster between the ages of 4 to 8. But keeping a baby in a harness is the safest option.
Well, we happen to have a real-life baby here with us today, Jaden. So why don't you show us how you helped his dad install his car seat correctly?
Sure. Alrighty, so we have this car seat installed with the seat belt, which is just as safe as an option as the lower anchors. So the seat belt, you see, we have in a locked position, and also we have it so snug that this car seat can't move more than an inch here. Also, Jaden is harnessed correctly where this clip is up at his chest where it should be, armpit level, and also it's so snug that we can't pinch any webbing up here. He's very snug. This should be like this all the time, every time a baby's in their car seat, and his headrest is appropriately sized for him as well. And he's rear facing as long as possible, up to 40 pounds here in this car seat.
Stephanie, you did mention that 80% of families are doing it wrong. What are some of the common mistakes?
Most common mistakes would be that this is too loose here, where the car seat's very movable. Also that the baby is not harnessed in correctly. Sometimes this clip is way down here or very loose. Those are our two most common errors.
Thank you so much, Stephanie. Now, Lori, people can actually come here to Adventist Health Castle to get free car safety checks done. Is that right?
They can. We're one of many places on the island that you can come to Castle. We do them twice a month. All you have to do is call for an appointment, call the Birth Center at Castle, and we'll be happy to let you know when and where.
Okay, perfect. Thank you both so much. Again, our children are our most precious cargo, so we want to make sure they are safe, right, when we're traveling around.
Yes.
Thank you.
Thank you.
Okay, now next week is National Child Passenger Safety Week. So Adventist Health Castle, in partnership with the KK Injury Prevention Coalition, will be hosting a free community car seat safety check. It's happening this Sunday, September 23rd from 10 to 1 at Castle. Reservations are not needed. Just show up, and you can also find more info on car seat safety at kipchawaii.org. It's so wonderful that they're offering this free to the public, you know.
It's literally saving lives because you definitely, like you said, precious cargo. You want them in there tightly, the way it's supposed to be used.
And that was a true story. I remember so clearly. It was raining the day we were taking Malia home from the hospital, not the airport, the hospital. And we had her in the car seat, but we couldn't figure out how to get that car seat into the car. And it was raining. And, you know, I had just had a baby. And I'm like, oh, my God, we don't know what we're doing. And that happened a lot, like when I gave her the first bath. I'm like, we don't know what we're doing. There was a lot of that going on with the first child.
Parents, kids think their parents know everything, and we tell them that we do. We're doing it as we go.
That totally changes when they're preteens, because now they think we know nothing.
Yeah,
that's the stage I'm in right now.
I'm not helping with homework, sorry.
Yeah.
All right, up next, in fact, talking about school, we're taking you to Hanalami School, where students there are turning on the lights to study.